Hello, my name is Jill Sangha, and it is my privilege to be a 2016 AMS Phoenix Fellow. I'm also a leader in support of the Patient Safety and Experience portfolio at London Health Sciences Center. I'm here today to talk to you a little bit about my project work through the AMS Phoenix Fellowship. The aim of my project is to advance compassionate care through the implementation of a longitudinal curriculum program that is integrated throughout the Pediatric Residency training program. In order to explain sort of how I got here, I want to first situate myself as a healthcare provider. I'm a social worker by background training, and in my role as a social worker, I had privilege of working alongside patients and families and really hearing the stories that they brought forth about their lives and about their healthcare experience. And it really challenged me to think about what that meant for me, hearing their stories, and also about the importance of being present in these moments. Fast forward now a few years, and I became a patient myself and a parent of a patient. And what I learned during these very intimate moments is that I learned what it was like to be a patient, but I also learned that I actually didn't have a true understanding or idea of what it meant to be a patient receiving care within our healthcare system. A lot of the focus today is on the medical expert role within training, so clinical assessments, patient access and flow, which leaves really little time to talk about elements of social medicine, about storytelling. And so even those residents who were really committed to this type of care, we found that it was often overshadowed by the demands of everything else that needed to be done within their training. Of particular focus to our team is looking at the skills, abilities, and attitudes of residents over a course of time and how that can be impacted by exposure, ongoing exposure of a longitudinal curriculum of this kind. It's included simulation learning, it's included discursive teaching, which also brings together patients and families to tell their stories. It includes an advocacy project that really gets residents doing hands-on learning, and it includes integrating residents into the context of the community. And so they're working in roles such as street outreach, they're doing home visits and school visits, and they're engaged in counseling and hoping through these experiences that they develop a deeper understanding of what it's like in the context of patients and families and the real world experiences. And so as AMS Phoenix Fellows, we're looking at how do we advance compassionate care, not only within our own organizations, but across organizations within our community and across the various systems that impact our patients and families.